Well, good afternoon, everybody. It's 4:30. We're just talking about. Asked Doris if she ever got thrown out of a gymnasium before, and I almost did one time. Almost got thrown out of a softball or a baseball game.
I'm shocked.
Outdoors?
It was at Shelbyville. You ever have baseball at Shelbyville? Man, that umpire was a crook.
What did you do?
I was watching the game. A long time ago, my son slid into home. The catcher dropped the ball, and he still called him out. And everybody saw the ball. It rolled 10 foot away from the catcher.
Oh, yeah?
And I was like, dude, he dropped the ball. He even said, one more word and you're out of here. I said, dude, he dropped the ball. I didn't get thrown out.
That was one more word.
You don't follow directions very well, do you?
Not at all. We're not here to talk about that. We're here to talk about
good stuff.
Physical therapy at
You got
HSHS.
You got it.
And we have Doris Zerrusen in the house.
Hey, how'd it
Yes.
happen?
I've been there at that hospital for 28 years.
Wow. I know you've been there for a long time.
Yes. Yes.
You were just a mere child.
I know. I started there in the X-ray department, and then I went back to school, got my PTA degree, and now I've been there for 26 years.
Wow.
So in the
Good
therapy
deal.
department. Yes.
Nice.
6 years. About the time my wife started there, I think, back in the day.
Yeah, and I would like to tell, hey, Kim, that little surprise is going to turn 18 this year.
Are you serious? 18? Oh, my gosh.
Kim knows what I'm talking about, too.
Okay.
I think HIPAA laws are out of the door by now. I don't think so, but
All right.
yeah. No, she
Yeah.
said you wouldn't believe the look on her face.
Exactly.
Yeah.
But
Exactly.
18, huh?
Uh-huh.
That's awesome.
Yes, yes.
Very nice. So
Yes.
you're here to talk about some physical therapy.
Yes,
and
I am.
What are we going to talk about?
We're going to talk about what the effects had on our older patient, the lockdown had on our older population.
Well, this could be very interesting.
You know what? It is. And the reason why I say that is because I enjoy working with the older population. They teach me a lot, and I like to talk, and so do they. So sometimes we get stuff done, and sometimes we don't. But however,
Hopefully
because
they're feeling better by the time they get done, though, right?
they do, because
Okay.
we have a good time. We smile, we laugh. But a lot of that's a lockdown, what had happened to them. A lot of different diagnoses like deconditioned, a lot of generalized weakness. What happened was it increased, with this lockdown, it increased their couch time by 2 hours a day.
Whoa.
Oh, my goodness.
Yes.
2 hours. That's a lot.
That
Yes,
is
it
a lot.
Well, and then when you get into your favorite little recliner, and then you kind of, get in there, and then that core strength is just gone.
Yeah, just
And
laying there.
so, yeah, and so they couldn't go to the mall to walk. They couldn't get anywhere, and the your total hip surgeries and your total knee surgeries were put on hold. So now they're already weak, and now they're even weaker because the surgeries were put on hold. So now the average visit that they would come in, it would take maybe 10 to 12 visits, and these patients would be getting better. It takes about 17 to 20
Oh, my.
because they didn't know the exercises to do. They got weaker because they were having pain, so they chose not to walk. And then guess what happens when you don't walk? Well, guess what? You still eat. And so your appetite is still there.
And you kind of put on some pounds.
Exactly. So there's a lot that has happened. So when they come in, they're I would say probably the last 4 or 5 months, we've had a lot of them that have been deconditioned, generalized weakness. They have hip, knee, back pain. So when they come in, a lot of it is just getting them back on the road to recovery, getting them to feel good about themselves, and this is the baby boomer generation. Are you a baby boomer? Are you a baby boomer too?
I'm in by like 2 months.
2 months?
So I don't
Okay.
consider myself a baby boomer.
Okay.
Really?
I consider my
Yeah.
next. Well, it was only like the last 2 months of the year.
Close.
In September.
Oh.
And after
like-
the next year, 65 was considered not baby boomer.
Because they said the age
Okay.
is 57 to 75.
Yeah.
So baby boomers 1 and 2. So it's not me yet. Ha ha ha.
That's the way it goes.
Exactly.
Yeah.
I'm a Gen Xer.
All right, yeah.
Yeah, she's a punk. She's a punk kid. So Doris, I got a question about a lot of people couldn't go out and do stuff. I mean, you could exercise some, but not much. How are you seeing patients who actually got COVID and recovered? Are you seeing them? Are they slower to develop
You know what?
and the long-lasting effects?
Correct. A lot of them we're seeing for respiratory. I wouldn't necessarily say that they had the COVID and then we're seeing them. A lot of the people have just respiratory issues, and it's not COVID. I mean, and that's what I've seen, in the hospital, and it's just respiratory pneumonia has just been rampant, but it's not COVID. It's just
interesting.
Yes. So that is when and everybody says, anything respiratory. Oh my gosh, and no, it's just pneumonia. And it's just getting them like the deconditioned and getting them up and moving. Walk 2 minutes and rest. And that's kind of what I do with these patients is I stand them up. We do exercises and then we sit down and we rest for a minute. So the recovery time. So how you base their progress is the recovery time. Sometimes it'll take them 5 minutes. Well, maybe the next time you see them, it only takes them 3 minutes. So that's how you base how they're progressing is the less recovery time and they get up and moving. So
that's good. I mean,
yes.
What all do you have them doing?
It's just simple exercises. Simple kick their knee out, sit to stand. We do standing exercises, kick the leg out to the side. So they're really simple, but they have to do them correctly because sometimes when they have the weaknesses, they start compensating. And so if you have one muscle that is really strong, like your quad muscle is really strong, well, if you're trying to do a different exercise, that quad muscle will kick in and say, I can do it. Well, your other one says, well, you know what? That's okay. You can do it. So one of the common weaknesses is this gluteus medius. Not the maximus,
Okay.
but the gluteus medius. There you go. You're going to have to look that up, okay?
Is that on above the butt?
Yes,
I guess.
it's right
Okay.
on the side.
Okay,
and
very
that's
good.
and that's for pelvic stability. Okay, and a lot of these older patients when they come in, that is a huge weakness, and so we work that. But sometimes they can compensate by doing the exercise wrong. So we are constantly nagging them. That's what I call them. I said, if I stop nagging you, then you're doing it right. So.
If she's not complaining, you're doing it right.
Exactly.
Nag away.
And you have to realize these patients, they have what they call Medicare dollars. That's all they need to do is get an order from their doctor.
Okay.
And come into our HSHS facility at 1301 North Maple. And you know what? You have Medicare dollars that you can use because they're always concerned about paying for it.
Sure.
Well, you have that money to use. So I'm like, so use it. But they're always afraid, they're concerned about the payment.
And they were brought up, back in the days, like,
Exactly.
oh, you got to save that money. Well, it's not really yours to save. It's Medicare, and you've paid for it for the past 65 years.
Yes.
So use it.
Yes. So that's what we're telling them. And it's usually typically about 20 visits. And so, you know what? Sometimes you can be cured or have the exercises in 10, and then maybe you come back 6 months later and you have a different diagnosis. So you came in with shoulder pain. 6 months later, you come in with knee pain. So you have that Medicare dollars to use. So use it.
Now, you said something about a doctor's order. Now,
Yes.
if they just have, just like typical aches and pains, do they just, hey, I've got some aches and pains, I want to do some physical therapy? Or do they have to have, do they have to have a knee replacement? Do they have to have hip surgery? Do they have to have a shoulder injury
Exactly.
in order to come see you?
Exactly. No. If
Okay.
you can come in with hip pain, right hip pain, knee pain, balance. Balance is a huge thing. Balance impairments is huge. Vertigo.
Okay.
And we have a specialist there, actually 2 of them, that works with patients who have vertigo or have balance problems. But sometimes that stems from weakness.
Yeah,
So first we
it
start.
all works around, doesn't it?
Exactly. So it just kind of, you start with strengthening, and then once they get better, then we can do some balance stuff because they're able to stand longer because they're stronger.
Yeah.
So it's just kind of, that's how it works. So, so you just go to your doctor and say, I have, back pain. A lot of it is back pain. And the reason why that is your core, because they sat in their chair and they hunkered down and watching those TV shows. And so they come in and we got to get,
They were Netflixing and chilling. That's
you
all I'm
got
saying.
it. You got it.
See, Hallmark watchers don't do that.
Oh, my
they do it worse.
Yeah, right.
They do it worse. Well, Doris, yeah, people are out of, if they're out of shape and they're hurting and everything, how's the best way to get things rolling? Is it to just see their doctor and they'll say, okay, go ahead, and they'll get in touch with you, right?
You know what? Usually they will fax an order in to us, and then we call them to schedule an appointment. Sometimes if you're a little antsy, you may call. And you can speed up the process. But obviously the number there is 217-347-1243. And we have an awesome office front staff that are very busy right now. So, and we try to get you in as soon as possible. One of the nice things about there also is the education that we give the patients. They come in with the back pain, but they're kind of understanding more of the importance of core strength, of what is going on. So we try to educate them about their condition, so they don't just leave just knowing, well, this exercise, what a pelvic tilt is. And so that's one of the, I think that sets us apart from other places, is the education that we give our patients.
Very good.
Okay, that's
All
great.
Right. Well, Doris, keep on doing what you're doing.
I will.
And
I will.
Have a great day, okay?
Hey, you too. Thank you very much.
All right. There's Doris Zerrusen from St. Anthony's Memorial Hospital, and get in touch with her. She will fix you up.
Right.
Getting into the groove.
Pick something groovy.
It's another classic hit.
The world's greatest artists are at